Fox 12 is following the money. Millions of dollars were promised for behavioral health treatment after voters passed Ballot Measure 110. But many of the organizations that provide that treatment are still waiting for the funding.
Fox 12's Simon Gutierrez takes a deeper dive into why that is and the impact it could have.
Voters passed Ballot Measure 110 in November of 2020. It was designed to fund behavioral health and treatment services through marijuana tax revenues. But after an initial wave of funding, treatment providers are frustrated by long delays on the requests for additional funds.
Will only minor children be living with you?
No.
On a Friday in mid-June, Tony Morgan walked into the Miracles Club on MLK in Northeast Portland looking for a new place to live.
I've been part of Miracles Club for 20-plus years, and so this is the first place I thought I'd come to talk to people that I know and they give me some advice and give me some direction to go in.
Morgan is a recovering addict who's 7 years clean. He leans on the team at Miracles Club, which provides 12-step programming, peer services, and clean and sober housing support.
To have support is one of the best things that an individual can have. You have to ask somebody that you can relate to and that can relate to you and help you go in the right directions.
So they got to follow through with it.
Miracles Club is one of many organizations who received financial support from funding allocated by Ballot Measure 110, which effectively decriminalized drug use in Oregon and dedicated a large chunk of marijuana tax revenue toward providing drug and behavioral health treatment.
When that money came out, all over the state, we were able to help 16,000 folks.
Julia Mines is executive director at Miracles Club, which provides culturally specific treatment options for Portland's Black community. Her organization asked for and got more than $200,000 in the initial round of funding from Ballot Measure 110, which was called Access to Care. But that grant ended December 31st, and like other providers, Mines has been waiting for the second and more substantial round of funding, which was supposed to arrive this past December.
I've got folks to try to hire. We've got bills to pay. I'm trying to keep staff, and if I can't keep staff, that means that all the money that I've invested in training or retention goes out the door because I got to lay folks off. And with the job market as it is right now, they're going to be snatched up because I got quality people.
Ballot Measure 110 requires the Oregon Health Authority to establish behavioral health resource networks in each county region. But 16 Oregon counties, including Multnomah County, have yet to have their network applications approved and haven't received funding for drug treatment and recovery services. In a presentation to the state legislature, OHA Director Pat Allen admitted the agency made, quote, missteps by not requesting sufficient staffing supports, not adequately supporting the grant-making process, and underestimating the number of applicants and the time-intensive nature of the review process.
We know that Oregon is either first or second in addiction in this country. We're 48th to 50th in accessing treatment. So that's saying that people aren't getting the help that they need.
Julia Mines says she and her staff want to help bridge that gap, but to expand services, she needs funding to hire more mentors and staff. Funding she's been counting on and waiting on for months.
People are dying out there. The fentanyl crisis is real. Just last week, we know 2 people that died from overdoses in our African American community. I don't understand why we can't just get through the red tape and make it happen.
You can track the Oregon Health Authority's progress using this dashboard on the Ballot Measure 110 website. As you can see, 20 behavioral health resource networks have now been approved. The counties you see in blue, including Multnomah County, are still negotiating with the state. I'm Simon Gutierrez, Fox 12 Oregon.